Hi, my name is Ethan Vissace, and today I'll be narrating my health promotion poster. This poster focuses on the problem of juvenile diabetes and is directed at adolescents between the age of 12 to 15. Juvenile diabetes prevention. What is it? Diabetes is a condition that affects the body's metabolism through the regulation of sugar. Although there are 4 types of diabetes, type 1 and type 2 are the most common. Type 1 diabetes represents 10% of all diabetes cases. It is also often diagnosed in children and adolescents and is caused by a lack of insulin. This is because their body has an autoimmune reaction that destroys the insulin-making cells in the pancreas. Type 2 diabetes represents 85 to 90% of all diabetes cases. It is often diagnosed in people above 40 and in recent years, juveniles. This is because their pancreas is not able to produce enough insulin to break down the sugar in their blood. This condition can also be influenced genetically. However, unhealthy eating habits and poor exercise can increase their risk. What are some typical signs and symptoms? People with type 1 can often feel thirsty, extremely fatigued, frequently urinate, tummy pain, unexplained weight loss, feeling generally unwell, and dehydration. Some typical signs and symptoms of type 2 is also often feeling thirsty, increased urination, particularly at night, feeling tired and lethargic, constant hunger, slower healing skin sores, itching skin, skin infections, and blurred vision. In 2020, diabetes was ranked 7th in the leading causes of death in Australia with a total of 5,148 cases. 1 in every 20 Australians were also diagnosed with diabetes. Now, what can increase your risk of diabetes? Some of the things that are in our control are actions like smoking of any kind, drinking too much alcohol on a regular basis, consuming foods that are unhealthy, being physically active less than 3 times a week. Some other things that aren't in our control are like living at a lower income, living in areas where healthy food options are not available, and having family with type 2 diabetes. These risks are important to note because 280 Australians develop diabetes every day. That's 1 person every 5 minutes. Adolescents who are also diagnosed with type 2 diabetes are predicted to lose 15 years of their remaining life expectancy when compared with their peers. Because of these reasons, diabetes is the fastest growing chronic condition in Australia, increasing at a faster rate than other chronic diseases such as heart disease and cancer. But what can we do to help solve juvenile diabetes? You need to think before you do. Junk food might look and taste better, but it's going to leave you feeling tired and bloated. Eating healthy foods like fruit and vegetables once a day can reduce the risk of diabetes and improve your overall wellness. Don't smoke. Smoking can contribute to insulin resistance, which can lead to type 2 diabetes. If you already smoke, try quitting. Keeping your body moving by doing physical activity more than 3 times a week. This not only will reduce the risk of diabetes, but also improve weight loss, heart health, liver health, and much more. You can also talk to your school nurse or doctor about what other options you can do to reduce your risk of developing diabetes. Thanks for listening.